Everyone has times when they're in a good mood or a bad mood. Sometimes people will say they're feeling depressed, but that's different than a mood episode. First of all, mood episodes occur over an extended period of time. With a depressive episode, we're talking about 2 weeks or more. And with mood elevation, it's at least several days at a time. The other thing about a mood episode is that it includes observable changes in behavior. That means it's not about feeling good necessarily, but it's about behaving differently than you ordinarily would. Let's start with depression. In a major depressive episode, one thing that seems true across the board from person to person is that there's a decrease in energy and a decrease in activity. This can look or feel like a loss of motivation. After all, who feels like doing anything when they have less energy? Or sometimes when people are depressed, they feel mostly flat or just have a lack of interest or excitement about things that ordinarily they would want or be excited to do. Major depressive episodes can also include changes in sleep and changes in appetite. Trouble concentrating and trouble making decisions can also be part of a depressive episode. In an episode of mood elevation, which might be called a hypomanic episode or a manic episode, there's an increase of energy and activity. The change in mood elevation is usually a feeling of elation or sometimes a feeling of irritability. People often feel better about themselves, so you could say an increase in self-esteem. Sometimes people are more talkative or have what's called pressured speech, when it seems like they just can't get all the words out fast enough. This is usually related to what we call racing thoughts or a flight of ideas, where thoughts just come really fast or jump from one seemingly unrelated thing to another. Usually, in an episode of mood elevation, people have what's called a decreased need for sleep. That means that while you might be sleeping less, you still have plenty of energy, and this can become quite extreme. Engaging in pleasurable activities that are higher risk than what folks ordinarily would do is another feature of mood elevation episodes. Insight and judgment can be impaired, and you can find yourself doing things that later on you might regret. When an episode of mood elevation is mild or even moderate, it can seem almost helpful to the person who's having it. The thing is, it can also cross the line into mania. Full-blown mania also can include psychotic symptoms, hallucinations, which are sensory experiences that don't exist, like seeing things or hearing things. Psychotic symptoms include as well delusions, which is believing something that isn't true. It's important to know that substance use can easily tip someone from that lower kind of hypomanic state into full-blown mania. To summarize, a mood episode is something that happens over an extended period of time and includes a change in behavior that is observable by others. If you want more information about understanding mood episodes or what a mood episode looks like for you, it's a great idea to talk to your provider about.